Good evening, everyone. I hope you all are doing fine. And today we have a very interesting discussion on topics connected with the paper of your PG diploma program. So the paper is Women's Health Issues and Concepts. And today is our which class, if you can recall. So today we are discussing very interesting topics connected with what you call as birth control. Yesterday, we had a broad introduction that we listed out some of the broad methods connected with birth control, which is popularly used between by the partners or between the couples. So, just to quickly wrap up what we have done so far, so that you feel the connectivity. So, we started this particular paper by discussing about important demographic parameters connected with women's health status. And as part of that, we discussed some important concepts like life expectancy, uh, fertility rate, infant mortality rate, maternal mortality rate. We discussed these concepts and what is the latest data which is suggesting about these concepts. We had a very broad overview about that. And then we went ahead with our discussion and we were talking about the concepts of what is nutrition and balanced diet. Because whenever you're talking about health, nutrition and balanced diet is a imminent part of it. And then we also discussed that what are the important nutrients in food, and in this connection, we're talking about carbohydrates, proteins, fats, water, and various other micronutrients as well, which includes zinc, magnesium, calcium, and things like that. And then we also had a discussion on what are the dietary requirements for women in different age groups. And our focus was exclusively on lactating and pregnant women and the elderly women, because the nutritional requirements, the physical bodily requirements in terms of nutrition for a pregnant and lactating women can be completely different when compared to elderly women. So we also discussed conditions like how in old age conditions like osteoporosis or unregulated diabetes, unregulated hypertension can be serious causes of concern. So less of salt intake, less of sugar intake, and appropriate amount of calcium to address the challenges connected with osteoporosis. We have discussed these topics. And then we also had a discussion on what are the various nutrition programs for women and children. There we were talking about programs like ICDS. We also had a discussion about vitamin scheme and a few other schemes connected with Matra Yojana, and we also Janani Suraksha Yojana we were trying to elaborate. Then from this, we moved on to discussing about how is the anatomy and physiology of the reproduction and what are the common gynecological problems usually women suffer. So in yesterday's class, a day before yesterday's class, we were trying to address this. And then during pregnancy, what can be the possible problems? So we discussed that during pregnancy also in different trimester, the challenges can vary from each other, and how in first trimester, second trimester, third trimester, and during pregnancy and postpartum means after pregnancy, what kind of challenges women usually confront. Then we stopped at this particular slide where we were trying to understand about what are the various birth control methods, and we listed out these some of these important birth control methods. Now let us understand slightly not too much in detail, but just what each method talks about. So there are multiple methods connected with birth control. So women can opt for, or the couple or the partner can opt for any one of this. So female and male sterilization, but this is the extreme where, after the uh, couple or partner has had children, they wanted to have one children, two children, or three children, and then they don't want further children. So, in such kind of a situation, this is one of the methods of permanent solution whereby after this there will be no scope of having children, and this we discussed in yesterday's class. So, female and male sterilization. So, where female tubal ligation or occlusion or male vasectomy, and birth control that prevents pregnancy for the rest of your life through surgery or a medical procedure. So here this is that birth control method after which there can be no childbirth. So usually once the couple or the partners have had the number of children they wanted to have, they usually go ahead with this. Then the next one is long acting reversible contraceptives. In fact, contraceptives have been used for many years by women to avoid pregnancy, and this has been used as one of the birth control methods, but again, this will have some amount of side effects, though we have latest medicines, latest contraceptives where there is lot of scope for like minimizing the side effects connected with the intake of these kind of contraceptives. So long-acting reversible contraceptives, or what you also call as LARC methods, intrauterine devices, hormonal implants. So birth control, your doctor inserts one time, and you do not have to remember to use birth control every day or month. LARCs last for 3 to 10 years depending on the method which has been used. Then similarly, we have short-acting hormonal methods also, which includes your pills, mini pills, patches, shots, vaginal rings. So birth control, your doctor prescribes that you remember to take every day or month. The shot requires you to get a shot from your doctor every 3 weeks. So it can be in the form of injections also. So depending upon what is the uh, chemical way of functioning of the uh, hormonal method, the duration is decided. Then we also have barrier methods which has been very, very strongly advertised. It includes condoms, diaphragms, sponge, and cervical cap. Condoms are openly advertised also as a method of birth control. And if you can recall, for a very long time, Nirod was also advertised on national televisions to spread that awareness to use condoms. So every time a person is having a sexual intercourse, condoms have to be used. Then natural rhythm methods, not using a type of birth control, but instead avoiding sex or using birth control only on the days when you are most fertile, most likely to get pregnant. So if you can recall when we were talking about the menstrual cycle time period of 28 days, there are certain days where there is a uh, high probability of being fertile, and there is a high probability of fertilization. But again, this is a condition which will hold good for those women who have very, very regular menstrual cycle. If the menstrual cycle is getting disturbed and there are gaps in the menstrual cycle, it is not regular. There are a long duration menstrual cycle, or there is lot of gap between one menstrual cycle and the succeeding ones. So in such kind of a situation, it becomes very difficult for the woman to ascertain that, okay, which day can be considered. So in such kind of cases, probably natural rhythm methods may not be of much help. An ovulation home test kit or a fertility monitor can help you find your most fertile days. So if this kind of challenge is there, you have an answer in terms of medical technology, which will help you to monitor that which days you are relatively more fertile. So these for these things also medical assistance, medical help can be taken. Now, depending upon the comfort level of the couple, comfort level of the partner, birth control methods can be used. But it is very, very important that whatever birth control method is being used, it is safe in the long run and it is done completely under medical prescription and medical advice and guidance to avoid any kind of challenges connected with future pregnancy or even if it is unwanted pregnancy. Now let us move ahead, friends. So this was a very, in nutshell, the important birth control methods, and in fact, there is lot of what can I say? Lot of awareness which is also being spread by Ministry of Health and Family Welfare regarding this birth control methods. Now we move on to our unit 10 or lesson 10, where we will try to understand that what are the common health problems connected with women. Now, so far, our discussion was mostly connected with menstrual cycle, menopause, pregnancy related challenges, or the exclusively gynecological challenges. Even those gynecological challenges are also part of health problems for women. So apart from those things, there are few more things which require some discussion. Let us do that. So women face unique health challenges. This is not to say that men do not face, but see, you will definitely agree with me when I say that the impact of hormones on women functioning, women's physiology is relatively more when compared to men. I think on this, no one can disagree, and that is why probably we have to give little more focus on health problems of women. It is not to say that men do not have health problems. In fact, most of the problems what women face, some of them are also, it can happen to anyone. So, the health problems of women is influenced by biological, social, and lifestyle factors. Let us have a broad overview. So, we begin with reproductive health issues. So, when we talk about serial number 1 and 2 and 4, we already had a discussion about that in our previous lessons. But let us have in nutshell so that whatever we had discussed earlier, that becomes more clear to us. So, reproductive health is a very, very important component of the overall health condition of women. So, reproductive health issues can include menstrual disorders, okay, when there are painful periods or heavy bleeding or absence of periods. And we have to remember one thing that menstrual cycle and pregnancy in married women, or like in any women for that matter, menstrual cycle and pregnancy, they are strongly connected with each other. Then we have another challenge, endometriosis. So it is a painful condition. This also we discussed in yesterday's class, where tissue similar to the lining of the uterus grows outside the uterus. We also had a discussion on polycystic ovary syndrome. So where there can be small cysts in like in the ovaries of the woman. This is because of the hormonal imbalances. Uterine fibroids. So fibroids are also very common problems among women, which hampers their reproductive health. Many times, because of the cyst, because of the fibroids, also women will have uncontrolled bleeding during the menstrual cycle. So these things, that is why, has to be monitored. Pregnancy related problems we discussed yesterday itself. So we are aware that conditions like high blood pressure, which we are calling it as preeclampsia or gestational diabetes, when the pregnant woman is developing diabetes, miscarriage and stillbirth, like in the before 20 weeks of the pregnancy, there can be abortions, unknowing abortions, stillbirth, like after a complete 9 months of gestation period, also the child which is born is still, basically it means the birth of a dead child, right? So loss of pregnancy either spontaneously or later in the term. Ectopic pregnancy, where the fertilized egg is implanted outside the uterus. So in ectopic pregnancy, if the risk is higher, then medical termination of the fetus is done because it is risky for women's health also. Otherwise, if it is carrying on, it requires a lot of medical supervision. We have also seen cases of ectopic pregnancy deliveries, but that requires tremendous amount of care and regulation. Then cancer is a common concern in today's time. But when we talk about women, gynecological cancers, which include breast cancer, and worldwide, this is one of the most common kind of cancers which women usually suffer. Then cervical cancer, which can be prevented, and you are familiar that there are many vaccines also to address the challenge of cervical cancer. But again, in that vaccine also it has to be taken in a certain age period, only then it is more effective. Ovarian cancer, see, whichever cancer it is, whether it is breast cancer or ovarian cancer or cervical cancer or uterine cancer, if it is detected in the early stages, very good treatment is available, and that can also facilitate longevity of the patient also, provided if the treatment is on time and the treatment is successful. So that is why nowadays people are insisting on regular health checkups, at least annually. Health checkup for women connected with mammogram, taking mammogram or mammography, or undergoing the pap smear test, which will help us to diagnose if there is any concern with the cervix, or also taking any kind of ultrasound related test under medical supervision. Osteoporosis problem we find even in men, but its instance is more in women. Now friends, like after menopause, which we have discussed in one of our sessions, after menopause there are a lot of physiological changes in the body, because of which what happens, that the absorption of the calcium becomes difficult in the body, and the bone density starts reducing to a great extent, and that is why there is a greater risk of osteoporosis among women. So women are at higher risk due to lower bone density and hormonal changes after menopause, leading to brittle bones. Brittle means your bones become so weak that it is easily breakable. Brittle means something which can be broken easily. So when the density of the bone is decreasing, naturally one is at a greater risk of any kind of fracture. Now let us proceed further. Now, friends, cardiovascular diseases, autoimmune diseases, mental health issues, even UTI. It's not that people are under the impression that it is only women who will have urinary infection. Even men are prone to urinary infection. Then chronic diseases. So these diseases are common. It can happen to any person for that matter. Now, with specific reference to women, when we are talking about cardiovascular diseases, so only thing is in terms of how much care the woman is taking about her own health. Many times what happens, certain symptoms of high blood pressure or certain symptoms connected with, cardiac issues, women tend to ignore in the name of, okay, a lot of work, I got exhausted, so probably I'm feeling this way. So this ignorance can further intensify the problem. So, like again, medically, it is said that after menopause, there is a greater risk of stroke. Medical, probably medical research has supported this kind of information. Then autoimmune diseases like lupus, rheumatoid arthritis, multiple sclerosis. So this is such a condition. Autoimmune diseases can also happen to anyone. Mental health issues can also happen to anyone, but as I mentioned, the hormonal functioning of the uh, hormonal functioning in women, especially during menstrual cycle, during the monthly menstrual cycle, during menopause, then postpartum depression. These are the additional challenges which women have to confront, and it can have a more serious impact on her mental health. Again, it is not to say that mental health is exclusive challenge of women. I'm not trying to suggest that, but because of these conditions, the mental health challenges intensify in women. So depression and anxiety because of the hormonal fluctuations, you tend to become anxious very soon. Depression, like if you're there is any challenge with your progesterone or estrogen, it can also lead to depression. Depression after childbirth, postpartum depression, what it is called, and eating disorders. You might have seen women either stop eating or they do overeating, binge eating. So eating disorders is also relatively more common among women. Urinary tract infections. So see, the anatomy of women organs related with reproductive organs or urinary organs are such, the anatomy is such, the placement of the organs is such that women have greater risk to contract the urinary tract infections. Urinary tract infections can be causing lot of discomfort, and again, in elderly people, if they are not having proper intake of water, all those things will have a long impact and urinary infection for a long time. Okay, that can lead to another set of conditions, especially among elderly women also. Menopausal issues, which I was discussing in one of our sessions, hot flashes, night sweats, mood changes, increased risk of osteoporosis and cardiovascular diseases. Then sexual health is also one important concern. Now, sexual health at different stages of life will have different kinds of impact. So, sexual health like vaginitis, if there is infection in the vagina or sexually transmitted infections, painful intercourse. We were discussing in yesterday's class when menopause is set in, there is relatively dryness in the vagina. So, because of that, intercourse, sexual intercourse can be painful. And again, hormonal changes also do not how to put this, hormonal changes also do not bring in that kind of enthusiasm or what you call as libido, that kind of sexual uh, arousal to go ahead with sexual intercourse. So this is also deeply connected with the hormonal surges in women's body, and it is very important to understand these things, especially until and unless women does not understand the hormonal surges in her own body, hormonal imbalances in her own body, probably she will not be able to understand why she is feeling irritated, why she is feeling depressed, why she is feeling anxious, why she is getting angry for no reason. So it is very important for every woman, for every person also. Again, do not think that I am only taking sides with women. Every person should understand their body properly, what is happening inside their body properly, and with specific reference to women. Hormones can be a very, very instrumental factor. Then chronic diseases, this anyone can have. It includes diabetes. So type 2 diabetes is common, with women often facing unique challenges in management, and obesity. Like the instances of obesity among women is also a challenging task. So obesity can further create a vicious circle of challenges connected with diabetes, heart diseases, and certain kinds of cancers. Before I do this slide, I want to discuss something on back pain, because usually women post 35, 40. In fact, nowadays even young girls are complaining about back pain. Again, back pain can be common both to a man and a woman, but in women, the instances of back pain is relatively higher when compared to men. So most of the women in different stages of life, they can, I'm sorry, they can suffer with back pain. Now, common causes, if we try to understand the common causes, musculoskeletal issues. So if there is a lot of tension in your muscles, if your muscles are very rigid, that also, especially the lower lumbar muscles, if they are very rigid, because of that rigidity also pain comes. And again, if you're suffering osteoporosis and your skeletal structure is also under a lot of pressure, that can also lead to back pain. So strain and sprain, often caused by sudden movement or poor postures. Many people, they have very bad postures, and that is one of the main reasons for cervical spondylitis. Nowadays, we sit long hours on the system without movement, and just keeping our neck like this in a very fixed position. So this is one of the reasons of more cervical spondylitis, back pain problems. Then herniated disc, when the cushion between the vertebrae slips out of place, pressing on nerves. So this is the vertebrae structure, right? And between the vertebrae, the nerves are there, and there is sufficient spacing between the vertebrae. So for some reason, if this space is reducing, now let us say there is a nerve passing, there is sufficient place for this nerve to pass, right? But when this space is reducing, what is happening? The nerve is getting pressed. So that can also cause back pain. Degenerative disc disease, which is again connected with age-related degeneration. Reproductive health issues can also cause back pain. So usually women complain of back pain during their menstrual cycle, and even when during pregnancy, because especially after the second trimester, when the weight of the fetus is increasing, probably her the entire weight falls on the spine of the woman, right? So if she's not taking proper rest and care, because of the increased weight of the child, she can have back pain also. Pelvic inflammatory disease, it is a kind of an infection in of reproductive organs, which is reflected through back pain. Okay, so osteoporosis, we have discussed several number of times. Autoimmune diseases and other causes can include sedentary lifestyle, poor posture, and obesity. So how this is impacting women's health? Of course, anyone who is having a back pain, their physical health can get impacted because your mobility is restricted. Because your back pain, you're not in a position to move very, very easily. Probably most of the times, either you're lying down or you're sitting, and your flexibility, your physical activity, your mobility gets impacted to a great extent. Then because your mobility is restricted, it has its impact on mental health, right? our daily activities gets impacted. So it can be diagnosed with the help of physical examination, X-rays, MRI, CT scans. See, there is so much of development of medical technology that you have very good ways to exactly ascertain that from where the back pain is actually emerging. What is the source of your back pain? Laboratory tests also will help us to understand are there any inflammatory conditions, and very important part in managing back pain is exercising. Now, when I'm saying exercising, it doesn't mean that you go to gym and start doing your push-ups, start running on the treadmill and lift heavy weights. No. People with severe condition of back pain should do exercises only under medical supervision of a physiotherapist. Once you have taken physiotherapy for, let us say, 2 weeks, 3 weeks time, and then whatever the physiotherapist has taught us the exercise, we have to follow that. Self medication, self exercise in extreme cases of back pain can boomerang. It can have a reverse impact. Weight management, maintaining healthy weight, appropriate weight is very important, and posture corrections is also vital here. There are several medications. I'm not going so much into detail. Why I'm spending little more time? Because this is one of the most common health problem which is in today's time being reported by everybody, even men who have crossed 40, 45, they are reporting this, right? But this is more common among women. So you have medications, you have physical therapy, you have alternative therapies also, including acupuncture, okay, and then chiropractic care where spinal adjustments to relieve the pain, massage therapy, but all of this only under medical supervision. Just usually, people's at in the family at home, they think, okay, there is pain, let me do some massage with some oil, and in that, when you are exerting more pressure on the back muscles, probably the pain can aggravate. And that is, see, nowadays, even when you go to doctors, the kind of oils or the kind of gels what we are getting, what doctors say, you just apply it and leave it. So that that gel or that oil, when it is getting absorbed in the muscles, it naturally relieves the pain. So unlike earlier times where there was a lot of emphasis on, physical massaging, doing aggressively, today's medical advice is you just apply it very, not with force, with a normal hand, you apply it and leave it so that the medicine gets absorbed. You also have medical interventions, including injections, and very extreme cases, surgeries, self care, and home remedies. See, for everything we have home remedies, and I think we all do this. Even if we are not a serious patient of back pain, let us say you have had a very hectic day, heavy day, and lot of physical activity you had to do. And in such cases, also using hot bag. Almost every family has a hot water bag or cold therapy, that ice bag, what you have. So using those, or people also use hot water, cold water, especially with knees. With back pain, it is not possible. And then, now if, see, this is, I was discussing about back pain so far. Now, overall, if we are talking about what has to be done to address the common health problems of women, then what is very important is preventive measures and health maintenance. We usually give our vehicles for, every 3 months or probably every 6 months. We give our vehicle for annual maintenance or monthly maintenance, but we actually do not maintain our own body. It is true for most of us, including myself. That is why, with little of proactive approach, with little of preventive measures, lot of challenges connected with serious health conditions can be addressed. So as I already told you, pap smear, mammogram, bone density test, cholesterol screenings, they have to be done at least annually once. Then if required, especially if there is there are different kinds of vaccines, HPV related vaccines. So for that also age period has been prescribed. So under medical guidance, those vaccines can be taken for adolescent girls. Healthy lifestyle. So this is equally important for everybody. Again, this is not an exclusive domain for women. Then mental health care, managing stress. I think stress is one of the largest killers. And in coming decades, the causes of our stress will also multiply. I would like to spend 1 or 2 minutes to talk about this because stress will become the largest killer. In fact, probably even in today's time, if you are under constant stress, it is creating a whole vicious circle for all kinds of health problems in you. See, our social institutions are undergoing changes, right? Our family systems, our kinship systems have undergone massive changes. Our lifestyles have undergone massive changes. Our emotional support network also has undergone a lot of changes. And on that, this climatic changes. Now you might definitely get bogged down at what Vinita is talking, how climatic changes is impacting your stress. See, climatic changes is definitely impacting every every biological creation, physically and mentally also. More constant periods of summer, don't you think it is impacting our health, our physical health, our mental health, the kind of irritation, the kind of anxieties because of extreme heat? And then larger humid conditions will also impact our overall well being, also. So, stress management is not a unilinear process. It is connected with multiple factors. So it is very important that we all develop our own ways, okay, or collective ways or individual ways to manage our stress. It can include simple things like doing breathing exercises every day, what we call pranayama, or doing yogic exercises, or going for a walk, pursuing a particular hobby of your choice, and having a very, what can I say, a very positive attitude towards things. I know it is very easy to preach. Probably when I am in stress, all these things do not work for me immediately, but that is how we have to train our minds for that. Then, what can be the safe practices with regard to sexual health? So, safe sex, regular hand washing, managing chronic conditions effectively. And that is where we would let us conclude this topic on common health problems of women. So, women's health requires a holistic approach. I think no one can deny this. Considering the biological, social, and lifestyle factors that impact their well being throughout different life stages. So, social factors is also impacting women's health to a great extent. Regular checkups and proactive healthcare measures are essential for maintaining good health and early detection of the potential health issues. So these are the some of the important components connected with the common health problems which women face. So friends, so far we have discussed 10 lessons, right? So, among common health problems, this is our 10th lesson which we have discussed. Now, let us proceed and try to understand how health, environment, and women are connected. Again, let me tell you that environment can impact everyone's health. See how it operates. Let me give you one simple example. Now, let us say in remote areas, of course, all the state governments, including central government, is making an effort to have tap in every home. Nal, har ghar, nal, har ghar jal, these policies, government is trying its best to implement. But still, complete implementation is still still not done completely. So if women usually who goes and fetches water for the entire family, it is the woman. Now let us say because of the environmental factors or because of climatic changes, there is serious drought in that village. Okay, so in such conditions, again, it is the responsibility of the woman. Probably in some cases, she is walking 10 miles, 20 miles just to fetch a pot of water, especially in those areas where there are drought conditions. Government definitely does it effort of providing water tankers, but I think you all will agree when government officials will agree with me that everywhere this is not being done possibly. So if there is a drought, right, because of the environmental factors, the first person to respond to such kind of natural changes, because woman is the natural caretaker of the family, right? So she gets impacted more. So that is why it becomes important for us to understand that how women health and environment is related. Now let us try to discuss this one after the other. Now, environmental pollution. When you talk about environmental pollution, 1 second, please, 1 second. Yes, I'm sorry. Now, especially when we are talking about environmental pollution, now air quality, air pollution, water pollution, these are serious challenges, right? When you talk about air quality, I think no one can deny this fact that air quality has become very, very poor due to various reasons. One of the reasons being heavy vehicular traffic also. So actually in this lesson, we have two topics, my dear friends. Rural environment and women's health and urban environment and women's health. So first, I would like to discuss broadly how women's health and environment, they are related and connected with each other. And then we will have a very subtle discussion how it varies in rural setups and urban setups. But for this contextual understanding is important. So once this contextual clarity is there, probably you yourself will be able to differentiate that how it varies in rural areas and urban areas. So when air quality is poor due to vehicular uh, traffic, or industrial emissions, where again proper type pollution check is not available. Industrial emissions, vehicular traffic, indoor pollutants also. That we should not be under the impression that our houses are the most polluted free because we are maintaining with so much of care and caution. In fact, the inside air can be more polluting in some situations. So, such poor air quality can lead to respiratory diseases, cardiovascular problems, and adverse pregnancy outcomes. Now, you might wonder that, okay, how like pregnant women is getting impacted with this. Now, please take your thought to rural setups, right? Where, of course, governments are trying are making best possible efforts to provide the gas cylinder so that the wood cooking using wood as a fuel, that kind of cooking is being can be avoided. But still, there are some things which have been left out. Water quality, if it is poor, in fact, World Health Organization it has recently released a report which says that 80% of the diseases what we suffer, the source is polluted water. Or if the quality of your water is not good. So contaminated water sources can cause waterborne diseases, which again affect women, especially in rural areas where they are often responsible for collecting water. So environment pollution is impacting the entire population and also, of course, women in specific. Chemical exposure. Now, who will deny that today's agriculture is extensively using pesticides and insecticides? No one can deny this. No? So at the end of it, of course, certain amount, certain level is safe for human consumption, but we all know that it is going beyond those levels also. So women working in agriculture or living near farming areas may be exposed to harmful chemicals, increasing the risk of cancers, reproductive health issues, and developmental problems future. So even if people are staying very close to those industries where there is relatively higher risk of unsafe exit of the polluted water, which is fully laced with the industrial chemicals, or the air, polluted air coming out of the industrial factories or industrial emissions, they can also hamper women's health. Household chemicals like cleaning agents, personal care products, and other household chemicals can lead to skin disorders, respiratory problems, and hormonal disruptions. Then climate change. This is what I was referring to you some time back. So climate change is leading to extreme weather events. So natural disasters like floods, hurricanes, droughts can lead to displacement, loss of livelihoods, and increased physical and mental health issues. Women, particularly in developing countries, are often more vulnerable due to socio-economic factors. So imagine when displacement is taking place. See, displacement can take place due to climatic conditions, weather conditions, and sometimes if a says special economic zone has been given to that area, or if there is a situation where some multi-purpose project is coming up. It can be a irrigation project or it can be a highway. Because of that also, if displacement is taking place, women will suffer relatively more. And this kind of development, it has also been called as development induced displacement. So many times displacement which is taking place because of the infrastructural projects which is required for development. So that is why that term is called as development induced displacement. Then there are also challenges connected with food security. When because climate change is going to impact agriculture process, agriculture production in a massive way in coming decades. And you all are familiar that especially country like India, where there is more consumption of rice. So rice as a crop requires more amount of water. And that is why, like government is also promoting consuming of millets because millets in its production process do not require so much amount of water as is required in the rice. And because of this climatic changes and malnutrition and food scarcity, which can again impact women's health, especially the pregnant and lactating women. So just try to join those dots that how food security can is impacted because of climatic change and how women get impacted. And then also occupational health. Occupational health, especially if agricultural work, women in agriculture face physical strain, exposure to chemicals and accidents due to various factors like inadequate safety measures. And even in informal sector, if you see, in informal sector also many women work in informal sector. In fact, this is an open fact that uh, working conditions in informal sector or the conditions of the laborers who are working in informal sector, their conditions are really more challenging. So poor working conditions leading to musculoskeletal problems, again connected exclusively with women health, exposure to harmful substances and limited access to health. Now, access to healthcare is one of the major challenges which is faced by significant population in our country. Definitely, we have programs like if you talk about Telangana, we have programs like Arogya Shri, and we also have a national level program called Ayushman Bharat, which is facilitating that even poorest of the poor can get good health care. But again, it is required that these policies information should further filter to the most grassroots level so that even the poorest of the poor gets benefited with this. But these are definitely very good programs, and these programs are definitely facilitating better healthcare and access also. See, we are doing really very good, but we have to still work on it so that even the last person in the lowest ladder has no trouble in getting quality access to good health care. Then, when we talk about women health and environment, this can also be one very, very important factor. That how sustainable practices. Now, see, if you can see the title of serial number 2, women's role in environmental management. So it means what? If there are challenges because of environment, women can definitely play a better role to manage environment. In fact, you must have seen if you read any policy document on environment, any policy document on women empowerment or climate change, you might have definitely come across one very critical concern that the involvement and participation of women in decision making is very, very limited. And that is why many experts, many activists, and even government, even the state governments, the central government, and even international development institutions, they definitely accept that there is need for better participation of women in the decision making. So when you talk about women, my dear friends, in terms of environmental management, then in with regard to sustainable practices, those practices which can sustain for a longer term, resource management, women can play a very, very important role in terms of managing household resources. You remember how our mothers would take care of the family even if the salary of our fathers wouldn't come on time. So I think that skill of managing the household is a natural skill what has been given to women by nature. So women can be fantastic management of the resources, whether it is household resources or whether it is water, food or energy. And their practices and choices can promote sustainability, such as using fuel efficient stoves, managing waste and conserving water. In fact, I'm sure you are familiar that there is one entire branch called as ecofeminism. So ecofeminism is all about how women can be at the center stage. Yeah, women can be the most focal stakeholder, most focal participant, most focal leader in the entire process of the environment management or natural resource management. Then agricultural practices, women can play a very, very important role where she can be instrumental to adopt those farming techniques which can help us preserve the soil health and also not only preserve our biodiversity but also expand it. Women can also play an important role in advocacy and leadership. So, where community leadership at community level, women can often be the grassroots leaders. And in fact, if I talk about self-help groups, they are doing very good work in this direction. And you might have seen even the NDA government, they are talking about drone DDs, right? So it means what? If you are giving leadership roles to women, even at the most, most lowest grassroots level, rural areas, lot of advocacy for clean water, sanitation, and sustainable development can be taken care. Policy influence. So this is what I was telling you. At policy level, also women can play a very very important role. And then with regard to education, see it is extremely important that awareness is the key. Education is the key. And that is why women can educate the families. If women are educated, if women have that awareness, they in turn can definitely educate and spread awareness in their families and communities about health risks associated with environmental factors, and they can also use better preventive measures also. And environmental education, not only health education, but also environmental education. So, what we are going to do, friends, I think there are just 2 minutes left, so I will not start a fresh slide explanation. I'm only trying to communicate that in this slide, we have tried to understand that how environment impacts women's health. In this slide, we are trying to understand that what role women can play in managing environment. And I'll just introduce you to this detailed discussion. We will do it in tomorrow's class, like gender specific health concerns related to environment. So this also, in a way, we have discussed. It's a kind of a revision, you can say. So with regard to the environmental effects on the health of women, there can be impact on reproductive health, mental health, and nutritional health also. You remember we started our lesson with balanced diet and nutrition. So all those things will get impacted if the environmental factors are not supportive. See, if environmental factors are bringing in more challenges connected with food insecurity, our soil health is impacted, because of which you cannot, cultivate the seasonal fruits and vegetables. Then definitely the entire ecosystem connected with the balanced diet, nutritious diet gets impacted. So, friends, let us rest our class with this. I thank you all for joining me for today's class. And tomorrow we will continue our discussion and take ahead that how in rural and urban environment uh, impacts women's health to a great extent. So thank you all so much. I see you all tomorrow again, 8 o'clock, and we will continue our discussion on this topic and also talk about major healthcare system in India. Thank you and good night. Take care, all of you.